happens for those patients then? What is the potential outcome for them if they don't get seen? What are they looking at?
Yeah, if they don't get seen, then they're looking at potential joint damage. That may be very permanent. With rheumatoid arthritis, within a year, you can have permanent joint damage, and that's you can't regain that. So it is very, very important that they be seen earlier. But we just physically can't see them all at the ideal waiting times because we just don't have the resources. They just aren't there.
And the national standard to see these patients are between 6 weeks to 3 months, and they shouldn't really wait any longer than that to be seen.
Those are the worst.
Yes, for inflammatory arthritis.
Yes.
Yeah, that's the standard in terms of waiting time that should be. Not 9 months or a year.
And like I mentioned earlier, if these patients don't get the treatment in a timely fashion, the joint is completely destroyed. They're completely debilitated, and then we're forced to recommend a joint replacement for them, which is in its own right very effective and helpful for the patients in terms of the pain control. But it's a shame that they have to go to that particular route if they could have been seen at an earlier time, and probably would still end up with a joint replacement but could delay it for a fair period of time.
But they go on a wait list then for that.
Then they go on a wait list for that.
70 years old, how much time do you have?
Well, our population base is living longer and longer, and we're pleased to see that. When I first went to Corner Brook 20 years ago, patients that I saw at 20, they're now 40, 60, they're now 80. Patients I saw at 80 when I first came, some of them are 100 now. And when you look at the news, you look at the birthdays, 90 years of age. And so that particular population of patients are more active, want to keep going, so they want some form of a joint replacement as needed. And the other side of the coin when it comes to orthopedics is the younger patient. The younger patients who are more active, they have early destructive joints, and they're requesting the services of arthroplasty as well. So it's a sort of a merry-go-round as to the way we are able to provide care.
Mm-hmm.
And there is another point here, is when we look across the country, and we have to remember that we live in Canada, we don't live in a third world country. This situation is far better in many parts of Canada. I won't say that there are parts that are not as bad as Newfoundland, but we are practically, back to what Dr. Rahman said, we're practically at the bottom of the heap when it comes to waiting, to the worst waiting lists and access to arthritis specialists.
That's in the developed world.
In Canada.
In Canada.
Yeah. And the developed world, you heard the comment about Sweden and other countries.
Mm-hmm.
Dr. Hamilton, you mentioned earlier suggestions. You'd like us as to what could be done. Obviously, there's probably monetary issues.
Well, I'll only go as far as to say is that in order to recruit more rheumatologists and also retain rheumatologists, what we have to offer trainees that are finishing, we have to be competitive across the country because we're competing with 9 other provinces for rheumatologists, and we have looked at Newfoundland. We're look at us now. We only have 4, so other provinces. Other provinces are better off than we are. And Newfoundland as a place, it's hard to recruit. Let's call it what it is. It's hard to recruit people to come here, and for many different reasons. And maybe you may know some of them, but so we have to be competitive. And the only way we're going to get people here is to be competitive and to also provide that work environment in which people are happy to come and are also happy to stay.
So those 53 graduates, I mean, if you were to convince one of them, it seems one of them would be a big coup at this point.
Yes.
What would you have to offer them if you consider, you say Newfoundland is a hard place to get them to come to?
Right.
Wouldn't you have to offer even more remuneration than somewhere else? What would you have to offer just one of those 53 to get them to come
Okay,
here?
that's a good point. I'll pass that to Brendan.
In terms of, again, the whole point of recruitment, obviously, is the remuneration, but it encompasses a lot of other things. I mean, they have to come to an environment where they're welcomed. They're not under attack all the time by various individuals who criticize folks when things don't go their way. But the only way that we can be competitive is quite clearly laid out. And basically for us, we're looking for Atlantic parity, and there were many individuals, many of those 53 people who, well, a good proportion may end up going to the United States to start with. So then you're left with whatever is left. And then whatever is left, if that individual wants to come to Atlantic Canada, as these three gentlemen did, then we want to be competitive in Newfoundland and Labrador. So they want to come to Atlantic Canada. They're deciding to go whether to PEI or St. John or Newfoundland or Nova Scotia. If we're not competitive, then it's pretty clear people just starting out, these 53 students have incredible debt. They have a lot of issues that are ongoing for them. So those are the factors that come into play. So we're certainly in a corner when it comes to try to entice people. And you can imagine people going to Alberta, British Columbia, or Ontario, where remuneration is much, much higher. But again, it's for people who would wish to come to Atlantic Canada and come to Newfoundland if they felt it was the right thing for them.
And to put it into some other perspective, if you look at Canadian grads that have come to work here as rheumatologists, I think Sean came 23 years ago, and then there was a decade waiting. I came 11 years ago, and no one since, in terms of attracting Canadian grads to come and work here.
You were the last Canadian grad who came here,
Yeah.
11 years ago.
There was one who came just after you, and she left.
Okay.
Yeah.
So you're the one that
Okay.
Yes.
Why do you stay?
Sorry?
Why do you stay? Why do you want to stay here?
Oh, it's lifestyle, I think, so I'm not really talking about leaving, I'm talking about trying to make things better for our patients and also less stressful for us. There's lots of bonuses in terms of staying, and even the work here is gratifying, because it's nice to look after patients that really need your help. We just need a lot more help in terms of looking after individuals that are being missed by our system. And we just want not to work as hard because, if you're working twice as much as the average rheumatologist is, it's just you burn out, and that's what the big issue is. It's not about not being satisfied and getting up and leaving. It's more, for me at least, it's more about not trying to burn out, and trying to lead a productive life.
Dr. Hamilton, could you give me these numbers again about how many Newfoundlanders you figure have the disease and how many rheumatologists you have to treat them? I missed it.
Okay. About 89,000 Newfoundlanders and Labradorians have some form of arthritis. And right now in our province, we have a total of four rheumatologists, but because of our other commitments with teaching and research, we have essentially 2.5 full-time clinic rheumatologists. So those are the numbers.
And looking at the head table now, what are the percentages of the rheumatologists I see here now that the province has?
75%
75%.
in front of us, or in front of you.
We've-
Pretty desperate, isn't it?
So that's for adults, I should make that clear. That's adult rheumatologists.